Hi guys, I'm Dr. Ben Behnam, board certified dermatologist, and this is Dr. Sean Behnam.
I'm Dr. Sean Behnam, Dr. Ben's twin brother, and we work in the same practice. Dr. Ben does all the medical hair loss treatments, and I do all the surgical treatments.
I was one of the first pioneers of stem cell hair loss in the US back in 2016, and Dr. Sean is actually one of the very early ones who did FUEs starting back in 2010.
Yeah.
So today, I'm actually very excited to show you another stem cell hair restoration video. This is super cool because this is both of our alleys. So this is a patient who had done a hair transplant somewhere else, in overseas, somewhere else, but he came in saying that a lot of the areas where they transplanted never grew out. And this is kind of like a very, sometimes we hear that. So, and he wanted to see what we're gonna do about it. So we decided to do a stem cell procedure on him. And the reason is because sometimes the hairs could be there, but they might sometimes be dormant. So we kind of have to like shake them up a little bit, basically to start growing them out. So we decided to do PRP with stem cell. We take your own PRP. That means we take your own blood, we spin it, we take the really good part of the your blood, and we concentrate the platelets, and then mix it with umbilical cord stem cells. Really the highest concentration available, the highest caliber from the best company there is. And then we numb the area in the front using actual numbing, and then we do a very special technique of stem cell placement right in the frontal area.
Correct.
And the technique is unique because you really have to be a certain amount of centimeters apart from every injection. So literally in this area, we probably did 500 to 700 or even 800 very tiny injections of the stem cell. And this is him a few months after. This is how it looks like. So this is actually about 3 months after, so he probably has a little more hair growth. But if you compare it to before, what you see is that the area really thickened up in that frontal area. So he's very excited about it. And again, we actually see this quite, not common, but we sometimes see it where the hair transplant doesn't grow. So we do some PRP or stem cell to really thicken up the area.
And actually, in this case, he did amazingly well. This is just after a few months, and the hair will continue to grow and it's going to become thicker and thicker.
That's right. Well, thank you so much for joining us.